Promotion and sustained support of breastfeeding. Learning why to promote breastfeeding. Breast milk is the best natural nutrient for infant feeding since there is hundreds of benefits from breastfeeding for both mother and infant. Breastfeeding benefits infant by promoting overall health, growth, both physical and intellectual development, reducing the risk of many diseases early in infancy, which includes infections and malnutrition disorders. And also, it protects the infants against diseases which occur late in childhood, like asthma, atopy, obesity, diabetes, inflammatory bowel diseases, and other chronic diseases that occur later in childhood. Breastfeeding benefits mothers by reducing postpartum bleeding, a rapid involution of the uterus to its normal size and position, and prevents the risk of breast and ovarian cancers, diabetes, and heart diseases. So, breastfeeding benefits the mother like the infant. Lastly, breastfeeding yields economic benefits to the family and the society because it doesn't cause a financial burden over the family and also over the society, since sometimes shortage of milk substitutes may be present, and if there is it needs a large budget for its import milk substitutes, and this is may cause a financial burden over the family and over the society as a whole. How to achieve successful breastfeeding in the community? In 1991, the World Health Organization and the UNICEF established baby-friendly hospital initiative, which supports and recognizes hospitals and birth centers that offer an optimal level of care for infant feeding by following 10 steps to successful breastfeeding. To achieve successful breastfeeding, we use 10 steps. These 10 steps is very important in order to achieve a successful breastfeeding and to get utmost benefit from breastfeeding for, as we said before, for the infant, for the mother, and for the family and society. What are the steps for successful breastfeeding? Number one, we should have a written infant feeding policy that is routinely communicated to staff and parents. Number two, ensure that the staff have sufficient knowledge, competences, and skills to support breastfeeding. Number three, breastfeeding education for all mothers and assistance for breastfeeding mothers are important steps in the promotion and support of breastfeeding. Such education can be achieved by pre and postnatal, maternal, and child welfare centers, hospitals, health units, primary health care physicians, family medicine physicians, nurses, and trained healthcare providers. All these can give transfer the knowledge and the skills to the mothers. Number four, we should instruct mother about the proper technique of breastfeeding and support them to initiate and maintain breastfeeding and manage common difficulties, as we will see. Number five, breastfeeding initiation within 1 hour of birth. The mother should initiate breastfeeding as early as possible after birth, whenever her condition permits, and the best time is half an hour after delivery, because the infant is eager to grasp the breast, and it is give him a chance to grasp the breast, and this is one of the steps for successful breastfeeding. Number six, we practice breastfeeding on demand. What I mean by on demand, according to the need of the infant, according to the desire of the infant. Don't do restriction for infant feeding by a time schedule for feeding or for the time of the feed. No, let the infant takes the breast or feed when he needs. But when he sleeps too much, awake him to for feeding. But don't do or make a schedule or time schedule for infant feeding. Number seven, roaming in. It is important to establish and maintain adequate milk flow and promote mother-infant bonding. Don't separate the infant from his mother after delivery. He should remain in the same room with his mother. This stimulates the milk flow and the attachment of the mother to her baby, what we call a bonding. It causes a bonding between the mother and the infant, and it's very important. So, initiation of breastfeeding as early as possible, feeding on demand, and roaming in is a very important steps for successful breastfeeding. Number eight, or I want to say, if a mother and the infant are separated for a medical reason, So manual expression of breastfeeding should be encouraged to continue the provision of breast milk to the infant. Maintain milk supply, avoid use of supplementation, and prevent milk engorgement. So if there is a medical condition which causes separation of the infant from his mother due to any medical cause, the mother is going to express milk and give it to the infant by a cup and spoon, for example, not by a bottle, by a cup and spoon. You are going to give the expressed milk to the infant until the cause of separation is ended. You are going to, the mothers will go on resuming breastfeeding again. Number 8, and this is a very important point, is exclusive breastfeeding in the first 4 to 6 months of life. Nothing by mouth, even water, unless medically indicated. No milk substitutes is given, no drinks, no juices, no. Even water, don't give the baby nothing by mouth except the breast milk. Don't give formula supplementation which can interfere with an infant's ability to breastfeed, as well as decreases mother's milk supply, and should be avoided unless medically indicated. Unless I stress unless medically indicated. Number 9, avoid use of pacifiers and artificial teats as it can cause nipple confusion. If you give artificial teats or pacifiers, this may the child, the infant may accustomed to these teats or pacifier and refuse to hold the breast. Refuse to hold the breast, and this will lead to failure of breastfeeding. So don't use pacifiers and artificial teats which may cause failure of breastfeeding. Number 10, a hospital breastfeeding groups should be established and maintained to identify and eliminate institutional barriers and difficulties to breastfeeding. The hospital team is meant to be interdisciplinary and should be culturally appropriate. There must be a team is present in the hospital or in the unit or health unit or in other health institutes which provides health care to the infants in order to manage and support the mother and solve the problems of breastfeeding and support the mother to continue breastfeeding. This is very important for sustained breastfeeding. You promote breastfeeding by raising the awareness of the mothers about the benefits of breastfeeding and the benefits of breast milk for the mother and for the infant and for the society and family, and a team will support the sustainability of such breastfeeding by resolving the problems of which may occur during breastfeeding. Then, how to increase breast milk production? Sometimes the problem is inadequate milk supply. Before you are going to search for or shift to supplementary feeding or formula feeding, you are going to use to increase the breast milk production by factors which increases milk supply. First, you are going to increase milk supply. If it go, yes, you are going to continue breastfeeding. Reassure the mother and go on. If there is still an inadequate milk supply, you are going to think in adding a milk substitute beside breastfeeding. What these factors which increases milk production? Instruct the mother about the proper technique of breastfeeding. Proper technique is very important for milk flow and milk production and successful breastfeeding. One of the very important factors which causes failure of breastfeeding is improper technique of breastfeeding. So the mother should know the proper technique of the breastfeeding. Show the mother the proper technique of breastfeeding. Number two, frequent suckling. Frequent suckling is the best mechanical stimulus for milk production. The most important factor for increasing milk flow, breast milk flow, is frequent suckling. So instruct the mother for frequent suckling. This is very important factor for increasing milk production and flow. And also number three is a good nutrition and sufficient fluids for the lactating mother. The mother should be in a good nutritional status, sufficient fluids and water, because the 88% of milk is water. So the mother should take sufficient amounts of fluids, good nutrition in order to produce sufficient amount of milk. Nutritional status of the mother is very important factor for increasing milk production. Treat anemia and so on, and healthy food is very important for maintaining and increasing milk flow. The next number is good mood of the nursing mother. A lactating mother should be in a good mood. Anxiety and depression and home troubles may interfere with milk production. And the milk production, as I said, it is a reflex and can be inhibited by any emotional factors. So the emotional status of the mother is very important factor for milk production. يبقى good mood is an important factor for increasing milk production. We can use what we call galactagogues. This is maybe medicines or foods which increases milk flow. These medicines may be chemical like chloropromazine, for example, or herbal products like fenugreek oil. This may increase milk production in certain mothers, and this is you can use it in order to increase the milk production and milk flow. All these previous measurements are to avoid formula feeding and to establish adequate supply of breast milk. Mother, the next important factor in maintaining milk production and successful breastfeeding and promote successful breastfeeding in the community is mother support by proper management of breastfeeding difficulties. If you are going to solve the problems or the obstacles or difficulties or problems which may occur during breastfeeding, you are going to achieve successful breastfeeding and do good promotion for breastfeeding in the community. Management of difficulties of breastfeeding may be related to difficulties may be related to the mother or related to the infant. What factor or difficulties related to the mother includes the following. Number one, nipple abnormalities. Sometimes there is small nipple, flat nipple, retracted nipple, malformations of the nipple. And I want to say that small nipple is not against successful breastfeeding, because if the mothers practice proper technique of breastfeeding, the infant holds and breasts the areola, not the nipple, so the size of the nipple is not a problem against. But the flat nipple may be a problem. You can use artificial nipple. And if this fails, you can express the milk mechanical by manual or by mechanical expression of the milk by a pump, and you can express the milk to the infant and do nipple care, which may occur. This nipple care should be done during the late months of pregnancy and after delivery by nipple massage or so. This may cause enlargement of the nipple, and the frequent suckling of the infant increases the size of the nipple. So, how to overcome the nipple abnormalities? By nipple massage, negative suction of the nipple, by proper technique of breastfeeding. If there is a flat nipple or absent no nipple, you are going to use artificial nipple, or you are going to express milk and give it to the infant. Still, the infant is going to take the breast milk. What about number two? The second problem is sore nipple and fissured nipple. Sore nipples and fissured nipple is a severely painful condition which may interfere with successful breastfeeding and may be a cause of failure of breastfeeding. What the main cause of soreness of the nipple or fissured nipple is improper technique of breastfeeding. The infant grasps or suckles the nipple, not the areola, so is going to cause erosion of the nipple, soreness of the nipple, and may cause fissuring of the nipple. And this is a severely painful condition due to the rich nerve endings in this area. And this painful condition may interfere with breastfeeding and may be the main cause of failure of breastfeeding. How to overcome? You are going to give soothing agents, you are going to give antibiotics if there is secondary infection, and you are going to show the mother the proper technique of breastfeeding. If the mother do a practice, if the mother practices good attachment or good latch on, all this soreness and fissure nipple is going to recover completely within a few days. The third problem is the blocked duct. Sometimes a duct is blocked and the milk is retained in in acini, and there is a swelling in part of the segment or part of the of the the of the breast, and may misdiagnosed as an abscess. This swelling can be resolved by applying hot fomentation over the affected segment and the frequent suckling. This may cause recovery of these blocked ducts. The next problem is milk engorgement. Usually, the milk flow increases from the fourth or fifth day after delivery. This increased milk, the breast becomes full with milk. And if the baby does not evacuate the milk or expresses this milk by proper feeding or frequent feeding, milk is going to be retained inside the breast. The breast becomes stretched, full with milk, stretched, enlarged in size, hot, tender, visible veins, and flattening of the nipple. The infant can't grasp the breast. What to do? Immediate evacuation of the breast by manual manual expression of milk by manual or by a pump. You are going to express the milk and give it to the baby, and the mother should manage or practice proper technique of breastfeeding. The infant is going to complete evacuation of the breast, relieves the pain, relieves all these sequences, and you can achieve a successful breastfeeding. The next problem is infections of the breast, which may be a localized infection or a generalized infection of the breast. Generalized infection we call mastitis, and localized is like the breast abscess. How to manage? And in a breast abscess, you are going to give antibiotics and analgesics and incision of drainage of pus, and stop. The mother stops breastfeeding from the affected site until the recovery, and give the baby the other breast. In mastitis, on the other hand, you are going to give antibiotics, analgesic antibiotics, and continue breastfeeding because there is no pus in the milk, unlike the breast abscess. Pus is drained in milk, but in mastitis, no pus in the milk. The mother is going to continue breastfeeding beside treatment of the infection. Then there are problems which are related to the infant. These problems may be due to congenital anomalies like hair lip, cleft palate, prognathism. These problems can be overcome by using devices which can, by position of the infant, the mothers, by position of them, by using devices, special bottles. You express the breast milk and give it in a special bottles for cleft palate, for example, and so on. You can overcome this problem, and you may see during your practice an infant who refuses feeding. Infant who is refusing feeding completely. What's the problem? You are going to search for a cause. What are the most common causes for an infant to refuse breastfeeding? Number one, search for otitis media, ear infection, and mouth thrush, oral infection, mouth thrush, especially mouth thrush. Search for abdominal colic. Colics may interfere with it. Constipation, and nasal obstruction. Nasal obstruction, the infant is mouth breather in this condition, and he can't suck. This interferes with suckling. So you may have otitis media, mouth thrush, nasal obstruction, intestinal colic, or constipation. If you are going to treat these conditions, you are going to relieve the infant from these problems, and is going to resume breastfeeding again successfully. If we